Hello, folks. I'm Stephen Dean, Business Marketing Director of Semiconductor's Medical Business Unit. And this is Charlie, here on my lap, our grandson. Operating from my home office, we're sequestered at home like most of the world's population. We're babysitting Charlie because his mom must work. She's deemed essential. Essential. That's a newly used term in today's environment, isn't it? That's right. See, Charlie's mom is a nurse at a local hospital assigned to the intensive care unit. She's functioning as a resource nurse today in the ICU. She has 31 COVID-19 patients. And at the moment, 11 of those are on ventilators. So this is why Charlie and I are here today. To his mom, Erin, to all the nurses, doctors, caregivers, first responders serving on the front lines, we thank you for your service. To all those that must take risks who are deemed essential to make this all work, we thank you for your service. It turns out that Semiconductor's operations are deemed essential in all this as well, supplying semiconductor components as a critical part of the supply chain for medical device manufacturers. As the number of hospitalizations continue to rise due to COVID-19, the world's inventory of ventilators is being strained in unprecedented ways. On Thursday, April the 2nd, the President of the United States issued an order under the Defense Production Act to help ensure that domestic manufacturers can produce medical ventilators needed to save lives. This is a time in history we will all remember. This is a time where, according to a recent press release, Medtronic has shared all their design files of a particular ventilator with the rest of the world, making them public to enable partners to rapidly design and manufacture ventilators. This is a time where top-tier automotive, aerospace, and white good companies are developing and producing ventilators. This is a time where medical device manufacturers ramp their ventilator production to 24/7. This is a time where universities and colleges worldwide, such as Cornell, Rice, the King's College in the UK, are developing ventilators from 3D printed parts and commonly available materials. This is a time of regional and global collaboration like no other time in our history. Think about that. These stories are truly remarkable, as we all live in remarkable times. So what is a medical ventilator? Ventilators move air in and out of the lungs in cases where patients are not physically able to breathe on their own. Often the machine forces humidified or warmed air with supplemental oxygen into the lungs. Applications or use cases can be broad. Equipment can be found in intensive care units, emergency rooms, ambulatory, meaning first responder situations, and even in the home. Complexity can therefore differ greatly, but common variables in the system include the measurement of oxygen the ventilator is delivering during inspiration or phase, respiration rate per minute, tidal volume, which is the volume of each breath delivered, sensitivity, or how much inspiratory or trigger effort is required from the ventilator to recognize that the patient attempts inhalation on their own, peak flow or the flow of breaths, and many other limits and controls. So in closing, from a very personal perspective, the medical device community continues to provide my family with life-saving technologies. Know that I work in this space because I'm passionate about this space. And as a team, we intend to improve lives through innovative semiconductor solutions. So when seeking solutions for your next ventilator design, look no further than Semiconductor. Beyond the passion, seek partners that know how to serve the medical device space. Semiconductor's Burlington, Ontario, Canada facility is ISO 13485 compliant, and we've assembled many FDA Class II devices there. That's completely unique and frankly unheard of in the semiconductor space. Come back and visit us at onsemi.com, and thanks for spending some time with Charlie and I today. Know that your health and safety are at the top of our minds. During this time of quarantine, stay home, stay healthy, but stay connected. Bye for now.